on reste chez nous le plus possible. On vit tous les conséquences de la pandémie.
We're all experiencing the consequences of the pandemic, and some families are experiencing tougher times and with more uncertainty. If you lost your job, if you do no longer receive your paycheck and wonder how you will pay your bills at the end of the month. But not only that, but your grocery stores next week.
But like most organizations, food banks are facing new challenges because of this pandemic. With everyone staying home, they have fewer volunteers. And a difficult economic climate means that they're receiving fewer donations that they normally would, while demand rises. The staff at the Neighbor to Neighbor Food Bank in Hamilton told us they're getting more and more calls. And it's overwhelming for the volunteers who are spread really thin and working overtime to help their community. The work being done by food banks and their volunteers is essential, so there's no question that they need more support during this crisis. If you have the time and ability to help, reach out to your local food bank and ask them how you can help them. At the same time, I'm announcing that the government will provide $100 million to meet the urgent food needs of vulnerable Canadians, including those living in Indigenous and Northern communities. This money will help ensure that organizations can buy and deliver food to those who need it the most. It will help support organizations that you may already know, like Food Banks Canada, Breakfast Club, and the Salvation Army, and many more. And on that note, I do want to take a moment to thank all volunteers and organizers. Thank you for feeding our communities. We see you, and we are grateful for the incredible, tireless work you do, even in these extremely difficult circumstances, especially in these extremely difficult circumstances. You are doing essential work for our most vulnerable. You are showing what it is to be Canadian, to be there for each other in times of difficulty. Aujourd'hui,
Today I'm announcing that the government is investing $100 million to help the emergency food needs of those most vulnerable, those living in Indigenous and Nordic communities. Those funds will help food banks to buy and deliver the goods to those who need it. Since the beginning of this pandemic, food banks are facing particular challenges. For instance, many of their volunteers are retirees who are more at risk to catch COVID-19, meaning that they have less people to deliver services to a growing number of people. The caritative organizations and the food banks are doing an incredible job across the year for our communities. I'm thinking about the Maison de Cartierville that I have been knowing for years, where people are working extremely hard to help their neighbors. In my riding of Papineau, if you have time and the means to help these days, I'm inviting you to communicate directly with the organizations around you. They need your help. And with the announcement today, we are supporting many organizations that you might know already, such as Moisson Montréal, the Breakfast Club, and the Salvation Army. And I want to thank all the volunteers and organizations for their work. You're feeding your communities, and we appreciate so much everything you're doing. It's not easy, and there's a lot of requests. You're limited in your resources, but I know that you will continue to help your neighbors and to help those who need it the most. That's what we do in hard times. We are there, one for another, and we will be there for you. I know you are numerous in these days to go through tough times. The pandemic creates much uncertainty, and it worries you. But I want you to know that our government won't let you down. We're investing in food banks for you to be meeting the urgent needs of your family during this crisis. At the same time, we're offering financial support to those who lost their job or their paycheck due to COVID-19. We've put in place the Canadian emergency benefits that will give you $2,000 per month. Our government will increase also the GST credits to help those whose revenue is weak or modest. And we've said that the admissible adults would get up to $300 and up to $350 per child starting in May. But I can now confirm that they will get help this month in April.
Our government is also supplementing the GST credit to help low-income people. We had said that in May, every qualifying adult would receive up to $300 with $150 for each child, but I can now confirm that help is coming sooner, this month, in April instead. Our government has also been working with major banks to deliver benefits, including the CERB, through direct deposit. Effective today, people should visit their bank's website for information on how to enroll for direct deposit if they haven't already. Je sais que vous êtes nombreux.
I know you're many to want to know how long it will last. You're asking, when will you be able to see your friends and hug your grandparents or get people over for dinner? Last night I spoke with the premiers of provinces and territories, and we spoke about the sharing of data and projections. The good news is that we are testing much more people, and experts have new data to analyze. Provinces and territories are now putting their data up to date, and they will publish the new information soon. On our side, we work really hard to verify the last numbers in order to put them online. You can consult canada.ca/coronavirus to get the best information updated on the propagation of the virus. I'd like to tell you exactly when this will be all over. I often speak about weeks and possibly months, but the reality is that it will depend on each of us. The best way to minimize the impact of COVID-19 is to continue to follow the directives from experts. You know them. Stay at home as much as possible. Limit your comings and goings. If you absolutely need to come out of your house, keep a 2-meter distance with others. Continue to do your part, and I promise you, we will get through this. I want to conclude today with a message for youth and kids. Sunday, I will do a video conference focused on you with Dr. Tan. You can send me your questions today on the French CBC website or the CBC.
I want to close with a message for kids. On Sunday, I'll be holding a video conference focused on you with Dr. Tam. So send me your questions through CBC Kids websites by the end of the day, and I'm looking forward to answering you this weekend. Merci beaucoup tout le monde.
Thank you, Prime Minister. We'll now go to the phone lines for a few questions. One question and one follow-up. Operator.
Thank you. Merci. First question, Kate Bolingaro, Bloomberg. Your line is open.
Hello, Prime Minister. I have a question regarding OPEC. Canada
I'm sorry, Kate, your line is cutting out a little bit. Can you try and speak closer to the phone and a little more clearly?
Yes, no problem. Can you hear me now, Mr. Prime Minister?
That's much better. Thank you.
Okay, so my question is regarding the OPEC Plus meeting on Monday. Is Canada planning to meet with, has it invited to meet with, or is it already talk OPEC, other oil producing nations about coordinating output levels to help bring crude prices down? And what does the potential look like?
I can assure you that we've been coordinating closely with the United States and other allies in looking at the challenges faced by OPEC right now. We recognize that these catastrophically low oil prices are having an impact on many people's economies and indeed on Canadian oil sectors. We're trying to coordinate to ensure that we make sure that our economy doesn't face the kinds of challenges that it's been facing. We need to continue to support workers across the country. We will continue to work internationally to try and impact on the difficult decisions made by OPEC over the past weeks, and we will keep you posted on that.
And what is happening with the support package for the oil sector we've been hearing about?
We're continuing to work with provinces, with particularly the province of Alberta, to ensure that we're giving support to workers who are in particularly distressed industries. The wage subsidy and the Canada Emergency Response Benefit will be of help to people right across the country, including in the oil sector, but we recognize that certain industries are facing much greater stresses than others, and we will continue to work with the provinces. I can highlight that in our conversation last night, the premiers and I did discuss this. I heard directly from Premier Kenney and others on the importance of support to the oil sector, and we're going to continue to work with them.
Thank you. Operator, next question.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Mr. Trudeau, we're learning that the Trump administration has asked 3M to stop exporting masks, the N95 mask in Canada and Latin America as well. Can you give us more details on what you know and how do you find this decision, and how will Canada react to this? We're currently working really closely with the Americans for them to understand what we know real well right now, which is that the exchange between Canada and the U.S. are going in the two directions, particularly for essential goods and for medical personnel. There are thousands of nurses in Windsor working in Detroit every day, and the Americans depend on them. There are medical products and essential products that are going in both directions and across our border. It would be a mistake for our two countries to limit the access of one or the other to products and personnel that are necessary across the border. And that's what we're underlining, and we will continue to make sure that all that is necessary will come to the right place.
The Americans to highlight what Canadians know very, very well, that the level of integration between our economies goes both ways across the border, that we are receiving essential supplies from the United States, but the United States also receives essential supplies and products and indeed healthcare professionals from Canada every single day. I think of the thousands of nurses, for example, who cross the bridge in Windsor to work in the Detroit medical system every single day. These are things that Americans rely on, and it would be a mistake to create blockages or reduce the amount of back and forth trade of essential goods and services, including medical goods across our border. That is the point we're making very clearly to the American administration right now.
And a follow-up, Melanie?
Yesterday, Mr. Trudeau, you needed to do a follow-up with Washington regarding the medical material that were not coming into Canada. What did you find out about this? And also, to the question you didn't answer, will Canada retaliate by refusing to send material to the Americans if we're sending some already? We will always try to continue trade, open trade, and essential trade with the United States. We depend, both of us depend on the trade of goods and essential services on both sides of the border, and we will work to make sure that this continues to be possible, and we will encourage in those hard times this to continue. We will always do follow-up on the preoccupations regarding deliveries, but we are confident right now that we will continue to get what we need.
Thank you. Next question, operator.
Thank you. Merci. Next question, Tonda McCharles, Toronto Star. Line open.
Tonda, you might be on mute.
Yeah, I am. Sorry. Thanks for taking the question. Can you clarify? Last night, this order came from Trump to 3M company to cease their exports to Canada, and you've talked about how valuable it is. But have you, since then, put in a call to the president? Do you have one planned today? And You said it would be a mistake, but it's a done deal, is it not?
3M has indicated that it understands how important it is to continue with delivering on orders to places like Canada, because there is much trade that goes back and forth in essential services, and it could end up hurting Americans as much as it hurts anybody else. That is the point that we are making very directly and have been making for many days now to various levels of the American administration, and that message is getting through. Okay.
3M indicated that it would be a mistake to limit essential material trade, because all countries, every country needs to get material beyond their borders, and it would be hurting Americans to limit the goods and essential goods coming from Canada and other places. So it's something that we are currently underlining strongly with the American administration these days, including this morning.
As a follow-up, sir, you didn't indicate whether you have or will speak to the president today, but I'd like to understand from your perspective just how big a gap this leaves Canada's supplies of these crucial medical masks.
We continue to be confident that we're going to receive the necessary equipment. We understand that there are pressures across our healthcare systems in various regions on the dwindling supplies. That's why we are working so hard to ensure that we get the right supplies to them in the right amount of time. We've seen a number of Canadian companies stepping up their productions, which will be flowing soon. We're also receiving more shipments from places around the world. We will do everything we can to ensure that no part of Canada goes without essential supplies in facing this pandemic.
Thank you. Operator, one more question on the phone, please.
Thank you. Merci. Justin Ling, freelance. The line is open.
Hi there, Prime Minister. You've been imploring people to stay home if they can. You've been asking people not to go to work. But given that, why are you still sending in civil servants to run immigration detention facilities when that could seriously increase the risk of spreading the virus not only to those detained in the facilities, but to those workers who have to go back home to their families every day? Do you consider that an essential service to be locking up people who were applying for asylum here?
We recognize that there are many essential services that need to continue to be delivered for Canadian safety, for the well-being of our country, and ensuring that Canadians are safe needs to be a top priority. That's why we're going to continue to ensure that essential services get done wherever possible. Civil servants are encouraged to work remotely, to work from home. We know there are significant things that need to be worked on to deliver for Canadians, to keep Canadians safe at this particular time. And I want to take the opportunity again to thank the public service for all it does in these difficult times to make sure Canadians are kept safe and secure.
Well, it's not really a question of safety when you're locking up those who may have overstayed a visa or who applied for asylum. And certainly, it's been 2 weeks now since I first asked you about releasing nonviolent offenders, and nothing has happened. Your government has continuously said, you're looking at it, everything's on the table, you're looking at it, but nothing's actually happened yet. Why are you dragging your feet, and why has action not been taken yet?
I can actually inform you that action has been taken. We've been working closely with Corrections Canada and detention facilities of all types to reduce the vulnerability to the spread of COVID-19, to ensure that measures are in place to keep Canadians safe. We continue to look at other measures that can be taken, and we will take those measures in due course.
Brian Mullen, Global News. Prime Minister, on the issue of 3M, you're saying if the U.S. goes ahead with this, it could hurt Americans also because of the flow of supplies and resources across the border. Are you considering any retaliatory measures against the U.S.?
We are discussing very closely with the United States the importance of keeping the flow of essential goods and services across our border to help both of our countries. I am confident that the close and deep relationship between Canada and U.S. Will hold strong, and that we will not have to see interruptions in supply chain in either directions. Okay.
We will continue to underline to Americans up to what point it's in our mutual interest, on both sides of the border, to share those goods and essential services. It's something that is really important for all of us. And that's why I'm trusting that we will continue to count one on the other during this important crisis.
McGregor, CTV News. Prime Minister, within the hour, Ontario officials are going to reveal their projections on the number of cases and the number of fatalities we might expect in the province. Dr. Tam has said the federal equivalent of those models are being used to inform your policy decisions, require Canadians to dramatically alter their way of life. Don't you have an obligation to follow Premier Ford's lead and release projections on the worst case and best case scenarios about how many of us might die?
We have been releasing information every single day on data received from the provinces, updating it regularly on websites so Canadians can see the latest numbers and look at various models that use those numbers to make various projections. At the same time, we need to make sure that the projections that we will be releasing are based on the most accurate, the deepest, the most properly collated information out there. We are working with the provinces to be able to build a robust model to give the projections that people want to see. People are wondering, how much longer is this going to last? How many Canadians are going to be severely affected? These are things that we will be sharing with Canadians, but we need to make sure we have a better grasp on the accuracy of the data before we put projections out there. Okay.
We acknowledge that Canadians want to know how long it will take. How long will we have to stay isolated? How many Canadians will be affected? How many people will die of this? We will share this information, but before doing this, we need to be based on very precise data and better than what we have right now. And that's why we're working with provinces in order to have deeper data, in order to deliver a model that is much more based in reality.
I just want to return to the OPEC questions you were asked at the top. Can you clarify, is Canada at the table at Monday's meeting, or are you just dealing with the U.S. and the U.S. is the one dealing with OPEC?
We are continuing our conversations with the international community, including with OPEC. There have been communications between OPEC and Canada. We will continue to stress that we need to work together as a world to get through this economic crisis as well as a health crisis. We will continue to insist on that.
Okay, can you please clarify if that means Canada will actually be at the table? And also, I'd like to get your thoughts on whether Canadian producers should actually be cutting their production further. They've already had to do this. More is expected because of supply challenges. So is it a wise strategy for Canada to coordinate with a price-setting cartel that has caused many of the current problems we're seeing in the global pricing of oil?
Well, I can assure you that conversations are ongoing with the United States on how we can work together to ensure that we are countering some of the measures being brought in by OPEC, and we will continue those conversations.
Bonjour, M. Trudeau. Mathieu Goyer de Radio-Canada. On comprend que ce seront les Rangers.
Mr. Trudeau, we understand the Rangers will be in north of Quebec. Can you give us the details about their exact mission and their numbers? We know that Canadian Rangers are always present in the north to help in the communities, to help to serve. What I understand is that in Nunavik, Rangers will be there to help to install tents and infrastructures, medical infrastructures. We will have more details on the amount of troops in the hours coming. And in the hospitals, pharmacists are worried about lack of some medication. What do you do to make sure we don't miss any of those medication? We have a pretty strong industry in Canada. We ask to have to fabricate more products during this crisis that will be necessary. We work with the international community to make sure there's no shortage in Canadian hospitals. hospitals. We will continue to make sure to look at the resources we have so that no hospital, no Canadian is lacking of the medication he or she needs.
CBC News. I imagine you have seen the projections from Ontario and Quebec that will be released shortly. Can you tell us what your reaction is to those numbers and how this will change the federal approach?
I'm not going to preempt the announcement that Premier Ford is going to be making shortly. We have seen the numbers. We continue to work very, very closely with the provinces. We are very much looking to share national projections with Canadians in the coming days. But I can tell you that we know that this is a very difficult situation for Canadians. There are some very challenging projections out there that will emphasize how important it is for all of us to do our part, to stay home, to keep ourselves safe, to keep our loved ones safe, and to get through this as best we possibly can.
How do these numbers change the federal approach?
Our federal approach continues to be to do everything we can based on the best scientific advice to keep Canadians safe and to ensure that our economy bounces back strongly after this is all through. The measures that we're encouraging and asking Canadians to take, whether it's around self-isolation, whether it's around social distancing, which means keeping 2 meters apart, whether it's around ensuring that people are washing their hands regularly and for 20 seconds. These are the things that are going to help keep Canadians safe. As much as we can do at the federal level, as much as we can support, as much as we can bring in quarantines and decrees, ultimately, it is Canadians' own behavior that will make the difference in this. How we get through this depends on you, and that's why I'm so confident that we will get through this, because Canadians are always there for each other. We're looking to do the right thing. We will get through this together. Merci tout le monde.
And that concludes the Prime Minister's message to the nation on this Friday morning. I want to bring you up to date now on developments while the Prime Minister was talking. We've received news from that nursing home in Bobcaygeon, Ontario. We've just learned there have been another 4 deaths at Pinecrest. So the total so far, 20 seniors plus 1 volunteer who was also a spouse of one of the residents. They are all dead from COVID-19. And remember, that home has enough space for around 65 residents. This is where they live. This is their home. We also know that at least 24 staff there have also tested positive. 34 other seniors are showing symptoms. And we received word yesterday out of Alberta that there were 9 seniors facilities there that had seen a cluster. So, and of course, British Columbia, the first cases came out of seniors' homes, and an enormous number also in the province of Quebec. So this is the tragic theme we are seeing as these latest numbers come to us day after day. And we are going to go to Omar Sachedina right now. Omar, just want to pull up a point that the Prime Minister made. The first troop deployment, he said, of this outbreak of Canadian Forces members is going to be to northern Quebec and isolated communities. I know you spoke with the Chief of Defence Staff, Jonathan Vance, yesterday about readiness. Did he indicate how quickly the troops can be deployed?
Extremely quickly, and I had in fact asked General Vance during our call yesterday, Lisa, if the first call would be coming from Quebec, and he said, look, we are ready to deploy anywhere we have to. He did seem very focused during that call to make sure that those isolated, remote, and northern communities were well addressed, and we know that the military has a unique capacity to do this. We know in this case, we don't know the exact number of Rangers that will be going to northern Quebec, but we do know that they will be involved in things like field hospitals and also setting up tents as well. So we're waiting on those details. I should also say that the general also indicated that off the west coast there are 2 warships right now also able to respond to isolated communities along the west coast, and we know that on the east coast there are crews of 2 warships that are preparing to sequester in hotels if the call comes. And we also know that about 85% of the members in the CAF are basically working from home right now. So the priority, Lisa, is making sure that they are healthy. But the way this all works is that the ask has to come from the province or the territory. And in this case, at least with Quebec, it has.
Okay, so just so everybody understands, that means that about 84% of all of our troops are already in quarantine, self-isolating, so that they are good and healthy when that call comes to head to those northern communities where I know that they will be a welcome sight. Thank you for this, Omar. We're going to go to London now. Paul Workman. You know, some really stark numbers are coming out of the UK overnight. Paul, give us the picture from where you are right now. What direction is this going in?
Lisa, 684 more deaths overnight. That's quite a sizable jump. You're absolutely right. But this country is already looking ahead 2 weeks. They believe it's possible that the UK will reach a peak by Easter Sunday, a peak of 1,000 deaths a day. And that's when the country says it will review exactly what's been going on, what kind of state the National Health Service is in, how well the hospitals and doctors and nurses and other healthcare workers are coping. We do know that London has now opened a facility, a critical care unit that can handle 500 patients in this particular facility. It will take many more ambulances and many more healthcare workers to look after all of the patients they're expecting. The country will have a much better idea as well when they see how many patients are needed in that facility as they move forward and deal with what's going to be an extraordinary surge, I'm afraid, Lisa.
And there was that document floating around on new procedures at that massive makeshift hospital in East London. And the number that really jumped out at me, Paul, was that staff are being told to prepare for the fact that 20% of people who walk in the door of what was once the XL Centre may not come out alive. That is just so chilling for the staff, for people, the community, everybody.
It's going to be very difficult for all of the staff to cope with. It looks as if each consultant looking after these patients, it'll be one consultant for 42 patients. They will need huge numbers of ambulances, as I said, to deal with them. These people, they don't have the resources. They don't have that many ambulances to bring people in. So the rush could be quite extreme. The question for health leaders here is, can the system cope with it?
And speaking of leaders, I know that Boris Johnson issued another video message. So first of all, let's just take a listen to what British Prime Minister Boris Johnson is saying from his own quarantine.
Although I'm feeling better and I've done my 7 days of isolation, alas, I still have one of the symptoms, a minor symptom of I still have a temperature, and so in accordance with government advice, I must continue my self-isolation until that symptom itself goes. But we're working clearly the whole time on our program to defeat the virus.
Well, Paul, I mean, he clearly looks exhausted. He sounds rough, and he still has a fever. So why would it's kind of like counterproductive to hear the leader of a government say, you know, I'm going to stay here even though I have a fever. Obviously, that is the message everybody should follow. Stay home if you have a
He actually looks a little bit better today, Lisa, I think. And the health advice is very clear on this. If you still have any of these symptoms, you should continue in isolation. So it would be very hard for the Prime Minister to bring himself out and go back to work. And if anybody found out that he was still suffering from any of these symptoms, it would be a pretty terrible moment. We also found out today, Lisa, I should just add, that the Queen has recorded a statement at Windsor Castle that is going to be broadcast to the nation here and to the Commonwealth on Sunday. She said earlier that she really wanted to do this. She really wanted to speak to the nation. It'll be the fourth time only that she's done this at a period of national crisis or mourning.
And of course, in the Christian calendar, this is Palm Sunday, one of the most solemn days. So I'm sure that will be a great comfort for people to hear from the Queen. Everybody's wondering, obviously, how she and Prince Philip are, given their ages, and of course, Prince Charles, who tested positive, who is now out of isolation. But Paul, I want to go now to what's happening in Italy and Spain. We've been watching it so closely, as if to almost see, you know, into our own possible future. So are the cases leveling off at all?
There are indications that cases are leveling off. Spain is still recording more than 900 deaths overnight, and that, of course, worries people to a huge degree. And we all make the comparison, okay, if there are all these deaths, then surely to goodness, how can this disease be leveling off? But the Spanish keep telling us that the number of hospitalizations, for example, is going down, that it was at a level of an increase of 30% a day just a couple of weeks ago, and it's now down to about 10%. There was word actually from one doctor in Madrid who's in a very busy hospital, and he said for the first time now he's actually seeing some empty beds in their ICU unit.
Okay, so that is promising. Let's hope that continues. But while the focus is on certainly the worst situations, underreported, of course, in all of this are places like Africa, South America. Today we're seeing that the situation in Ecuador is particularly dire. What can you tell us, Paul?
Some really terrible pictures coming out of Ecuador. The funeral homes and the morgues are so overwhelmed that people are beginning to leave bodies on the streets to be picked up. There was, I think, in one particular city, Guayaquil, there was, by one count, 400 bodies that were sort of left out. The mayor has promised that he'll bring in refrigerator trucks to be able to look after this, but just a terrible scene, and terrible when you think about it, that there's no way to look after the dead, that people are so desperate they've taken the bodies and put them out on the streets.
Wow. It is just so tragic to see. We are seeing these things unfold in, the major metropolis of the world, like London, like Rome, like Barcelona, but to see it in countries that already have fragile healthcare systems and not the kind of stability in the infrastructure. It's truly overwhelming. Paul, thank you for bringing us the up to date on what's happening around the world, as well as you can. From there, I want to go to Tom Walters in Los Angeles now. Tom, first of all, this kind of threat sounded like a threat. The president telling 3M stop shipping those all-important masks to Canada. Does the company, who's already come out and said that's not going to work for us, do they have to comply, or what can you tell us on that front of that exchange that seems to have gone back and forth?
Well, I think under the Defense Production Act, there is a very high order of responsibility placed on a company to comply. But you're right, 3M has indicated that this is a measure that is likely to backfire should it go into force because of the global supply chain, because of the interconnectedness of the world, that were they to stop supplying masks. And what we're talking about here are those N95 masks. This is a step up from the surgical mask. It's the higher degree of filtration mask that's so important to protect healthcare workers. 3M is saying that if they were to stop shipping those masks to Canada or Latin America as ordered, that the actual net effect to the U.S. would be fewer of them coming in because of the number that come in to the U.S. from other countries.
Now, interesting, I thought, what the Prime Minister said. It was kind of like, okay, if you do that, we've got 600 healthcare workers, nurses that cross that Ambassador Bridge, 1,600 every day from Windsor to Detroit. I don't know. This is certainly a dangerous road. It sounds like they're going down on the part of the White House to pull much-needed medical supplies here, and would that be the trade-off?
Well, and certainly as a lever to use, it's a very powerful one because, as you know, the state of Michigan has got a very severe problem right now. The city of Detroit is very close to running out of supplies. There's been a big explosion of cases in Michigan over the past week. And with all of those healthcare workers, there are many who live in the Windsor area and commute to hospitals in Detroit. There is a significant population of healthcare workers there. It is, of course, in everybody's interests for those workers to be able to be moving around to where they are most needed. But, you know, as a quid pro quo for a lack of cooperation coming the other way, the reality is that across the Canada-U.S. border, you know, that border is no more of a force against the virus than any state border is, or any border between communities.
Yeah.
So the reality is that we're all in the same boat here, and to start getting territorial does nobody any good.
Yeah, and I say the same, a big shout out to all those truckers. Every time you see an 18-wheeler on the highway, you have to know that is the supply chain in action. And to hear that some of those rest stops are locking their bathrooms or those washrooms are being raided, it is just really disturbing. It's also happening, we're told, in this country. So it's such an important point to keep in mind that that exchange between Canada and U.S. is for both sides. But before I let you go, Tom, bring us up to date on that cruise ship in Florida. We know Canadian passengers were supposed to be on a plane right now for Toronto. There is some kind of delay. What can you tell us?
Well, we understand that some 243, in the estimation of the cruise line, will be on that flight as it makes its way to Toronto. It was scheduled for a departure at 10:30 Eastern time this morning. I've been trying to flight track it and don't have a confirmed departure time for it, but it is supposed to be en route anytime or already to Toronto. But I think the numbers are also something we want to keep an eye on, because we understood there were 248 Canadians aboard that vessel. If there are fewer than that, it raises some questions. Fewer than that on the plane, it raises some questions about whether some may require other transportation arrangements or are staying in Florida for treatment of the virus. We know that at least 26 passengers aboard that vessel have remained for treatment in Florida.
Okay, Tom, thank you so much for that. We will be watching as we hope that plane takes off and those people will be landing back in Canada. Automatic quarantine, of course. I want to go quickly before we leave back to our infectious disease specialist, Dr. Abdu Sharkawi. Doctor, yesterday the FDA did approve that new antibody test, so it sounds promising. So explain to us, give us some good news as this special broadcast ends today. How does it work?
Yeah, it's certainly a promising test. It really works the same way that you would test blood sugar with a single fingerprint blot of blood and then a couple of drops of reagent that's added to it. And it's fairly rapid, so apparently results can be turned around within as little as 15 to 30 minutes. What we have to recognize, though, is that like every other test, it's not perfect. There are lots of limitations to this. We have to remember this is a brand new virus. This is something we're learning about week by week and literally day by day. The full test characteristics are not optimally understood at this point in time. It takes at least 4 or 5 days into the onset of symptoms before the first antibody, which is known as the IgM, can indicate acute infection. And the optimal time for determining whether you have what's called the IgG antibody, which indicates you've been exposed and are now immune, that's not entirely understood or known at this point in time. So it's going to take time for Health Canada to review this. It's going to take time to make sure that we're not getting too many false positives or false negatives. But clearly it's a step in the right direction.
We are just about to go off air. I want to thank you. I want to thank everybody for watching. It's Friday. Stay home, stay on the couch, watch TV, as Larry David said, and enjoy your day.